Okay, so as a dental sleep medicine provider, you want to help as many people as possible. But in the real world, you're not able to help everyone because there are certain barriers that prevent people to moving forward with treatment. One of the primary ones is insurance coverage and just the ability to pay for the device out of pocket. Those two things are primary in preventing people to moving forward with treatment. Now, what do you do when you're running a marketing campaign and you have, let's say you have an abundant population of patients who have Medicaid insurance. Medicaid does not cover 0486 oral appliance therapy, so you are not able to, or that patient's not able to rely on their insurance. So what do? You need to automate the process of filtering, screening, and communicating with those patients so that your staff is not wasting time following up. 99% of the time, Medicaid patients will not be able to move forward with treatment. So what you need to do is have some sort of automation in place that communicates with those Medicaid patients for your staff, letting the patient know that their insurance doesn't cover this treatment. And also, you don't want to just leave them high and dry, say, sorry, you're out of luck, your insurance doesn't cover this, but you want to communicate your desire to help them. So you ask the question, would you like us to reach out and to discuss our financing options or our special cash pricing? Do that. You still value the patient, but you're also valuing your staff's time.